Hey everyone and welcome back to the channel. Guys, today we are breaking down a major healthcare shakeup that could leave over 1.5 million New Yorkers without the health insurance. So, guys, President Trump's newly signed One Big Beautiful Bill Act is aiming to reduce what he calls the wasteful spending. But experts warn that real people, not just the bureaucracy, will pay up the price for this. This law introduces cuts to the Medicaid, imposes new work requirements, and makes drastic changes to a little known but hugely important program in New York called the Essential Plan. So, guys, you might be wondering what is this Essential Plan? This could have devastating consequences not just for the low income residents but for the hospitals, clinics, and even middle class families. So let's get into it and let's dive into this. So, first, Medicaid under the new law starting in 2027, over a million New Yorkers could lose Medicaid coverage due to New York requirements. Recipients will have to work, volunteer, or attend classes at least 80 hours per month or risk losing their insurance coverage. Even those meeting the criteria could be cut off due to the any paperwork errors and red tape. This is scary, right? But the bigger and more immediate change hits the Essential Plan, a program unique to New York that covers people who earn too much for Medicaid but too little to afford the private insurance. It covers nearly over 1.6 million residents, including many immigrants. This is funded mostly by the federal government. The Essential Plan has worked extremely well in the New York. It even built up an $8.5 billion surplus and helped raise doctors and hospitals paid to the sustainable levels. But now, under Trump's new law, eligibility will tighten, especially for the non citizens. This move is expected to kick 730,000 people off the plan starting 1st January. About 5 lakh people may qualify for a backup state run plan, but 2,24,000 people could be left uninsured, especially immigrants who don't meet the new sticker criteria. And this doesn't just hurt the individuals, it also threatens the financial backbone of hospitals and clinicals statewide. So, guys, community clinics and public hospitals like NYC Health Plus hospitals rely heavily on Medicaid and essential plan reimbursements. With reduced funding and more uninsured patients, they will likely have to cut their services, close specialties like the pediatrics or behavioral health, or even shut down their entire locations. And guys, let's not forget when hospitals lose the money they pass cost to the middle class patients with private insurance. So guys, if you think this doesn't just affect you, think again. Premiums, deductibles, and hospital bills may soon rise and may affect your pocket. Trump insists the cuts are about eliminating fraud and abuse, but public health officials, hospital leaders, and advocates disagree. Kenneth Rask, head of the Greater New York Hospital Association, called it as the most destructive healthcare cuts in American history. The essential plan, once seen as a smart, efficient safety net, is being dismantled not because it failed, but because it worked too well. So, guys, here is the bottom line and my personal take. 1.5 million New Yorkers face losing health coverage due to this law. It's not just a budget shift, it's a real threat to the families, clinics, and the healthcare system as a whole. Will New York find ways to soften the blow? Possibly, but the damage has already begun and it will worsen with time. Cuts to Medicaid and the Essential Plan could push tens of thousands into medical debt, ER overcrowding, and poor health outcomes. So, guys, if this video helped clarify the stakes, hit that like button, share with someone who needs to know, and subscribe for more breakdown like this. And let me know your thoughts in the comments. Is this reform or recklessness? Should access to healthcare be protected no matter your income or status? And thank you so much for watching. And until next time, stay healthy, stay informed, and I will see you guys in the next video.